The first pain comes after sunset. At first, you keep working. Then another wave tightens across your body. And another. There is no hospital, no surgeon, no blood transfusion, no antibiotic waiting if something goes wrong. Only a fire, a shelter, and the people who have seen birth before. So how did ancient humans survive childbirth? The honest answer begins with a warning. We cannot watch a birth from 50,000 years ago. Childbirth usually leaves no mark on stone tools, cave walls, or adult bones. Even when a mother and baby die, archaeology may not preserve them together in a way that reveals what happened. Birth is one of the most important events in human life. It is also one of the hardest to see in the archaeological record, but bones, anatomy, evolutionary studies, and a few extraordinary burials allow us to reconstruct part of the story. Ancient childbirth was not easy because ancient people were stronger. It was difficult for the same reason human childbirth remains unusual today. Your baby has a large head, your body walks on 2 legs. And the path between those facts is narrow, curved, and complicated. The human birth canal is not a straight tube. Its shape changes from the entrance to the exit. In many births, the baby must rotate. While moving through it, the head turns. Then the shoulders must pass through in another orientation. This is sometimes explained as the obstetrical dilemma. Evolution had to balance a pelvis useful for upright walking with one wide enough for childbirth. That idea captures part of the problem, but modern researchers describe a more complicated picture. Pelvic shape is influenced by locomotion, body size, climate, development, the pelvic floor, fetal growth, and variation between populations. Metabolism also matters because pregnancy places enormous energetic demands on the mother. There was no single moment when evolution designed the perfect pelvis. There were only compromises that worked often enough. Often enough is not the same as safely. In 2009, Timothy Weaver and Jean-Jacques Hublin reconstructed the birth canal of a female Neanderthal from Tabun Cave in Israel. The result was surprising. The reconstructed canal suggested that Neanderthal childbirth may have been about as difficult as childbirth in living humans. That the shape of the canal indicated a different, more primitive birth mechanism. The fully modern pattern of rotation may have appeared relatively late in human evolution. That means difficult birth was not only a problem for recent farmers or city dwellers. It reached deep into the human family. Now imagine labor continuing through the night. You do not know how long it will last. You do not know whether the baby is facing the right direction, but you are probably not alone. Anthropologists Karen Rosenberg, Wenda Trevathan have argued that assistance during birth became especially valuable in human evolution. Human babies often emerge facing away from the mother, making it harder for her to see and guide the infant during the final moments of delivery. Another person can support the mother. They can watch the baby appear, they can help clear material from the infant's face, receive the slippery body, and respond if the core is wrapped or the shoulders do not pass easily. This does not mean every ancient birth had a trained midwife. It does not mean solitary birth was impossible. It means that in a species with a difficult, rotating birth process, help could change the odds. The first birth attendant may not have held a title. She may simply have been a mother, sister, aunt, elder, or friend who remembered what happened last time. That memory was technology, which position reduced pain. When should the mother rest? When should she move? What did normal bleeding look like? Which signs meant danger? No stone tool preserves those answers. They lived inside people. Knowledge passed from one birth to the next, not as a medical textbook, but as stories, gestures, warnings, and experience. The mother may have squatted, knelt, leaned, stood, or changed positions as labor progressed. Human societies use many birth positions, and we cannot prove which ones were used in any particular prehistoric camp. What mattered was flexibility. There was no fixed hospital bed forcing one posture. The body could move, the helper could support the back, hips, or arms. The group could make space, keep the fire alive, bring water, and protect the shelter. For many births, that was enough. Most labor does not require surgery. The uterus contracts. The cervix opens, the baby descends, the placenta follows. Human populations could not have continued if every birth ended in disaster. But survival of the species can hide enormous individual loss. Some mothers hemorrhaged, some developed infection. Some labors became obstructed because the baby could not pass through the pelvis. Some infants arrived feet first or sideways. Twins made everything more dangerous. One burial from the Lokomotiv cemetery near Lake Baikal in Siberia gives us a rare view of that danger. Around 7,700 years ago, a young woman died during an attempted twin birth. Researchers Angela Levers, Vladimir Bazalski, and Onze Weber found the remains of two nearly full-term fetuses in and around her pelvic region. The first appears to have been positioned feet, or bottom first. The second was head down. The labor became obstructed. Neither infant was completely delivered, the mother and both babies die. This is one of the earliest confirmed archaeological cases of death during childbirth, and the oldest confirmed evidence of human twins. It is powerful because it is so rare. For childbirth to become archaeologically visible, the mother and baby often must die together, remain together, be buried in a recognizable position, and survive thousands of years of decay and disturbance. A successful birth leaves even less evidence. A mother stands again. A baby is carried away. The fire goes cold. Nothing remains for archaeologists to find. So the record is biased toward unusual tragedy, while ordinary survival disappears. What happened after a successful delivery? The danger was not over. The mother could be exhausted, injured, bleeding, or vulnerable to infection. The newborn could lose heat quickly and needed frequent feeding. This is where human cooperation mattered again. Someone could hold the baby while the mother rested. Someone could bring water and food. Someone could care for older children. Someone could keep predators, strangers, or bad weather away from the shelter. A successful birth was not only the moment the baby emerged. It was the following hours, the next night, the next week. Human babies are unusually dependent. They cannot cling and travel as independently as many other primate infants. Caring for them while a mother recovered, gathered food, or fed another child created pressure for shared care. Researchers studying human evolution often describe our species as cooperative breeders. That does not mean one universal family system existed. It means mothers frequently benefited from help provided by fathers, grandparents, siblings, and other group members. The same network that supported childbirth helped keep the infant alive afterward. Plants may have been used for pain, bleeding, or recovery, but direct prehistoric evidence is limited. A plant that is medicinal in one dose can be useless or dangerous in another. Ancient people learned through observation and repeated experience. Some remedies probably helped. Some probably did nothing. Some may have caused harm. We should not turn uncertainty into a fantasy of perfect natural medicine. There was no hidden herbal cure for obstructed labor. If a baby could not pass, if the uterus ruptured, or if bleeding would not stop, knowledge and courage might not be enough. Many people die. That fact is part of the story. But it is not the whole story. The counterintuitive truth is that ancient humans did not survive childbirth because birth was natural. They survived because birth was social. Evolution provided a body capable of giving birth, but not a body guaranteed to succeed. The group provided what anatomy could not. Eyes watching, hands supporting, memories from previous births, food after exhaustion, protection during recovery, and care for a newborn that could do almost nothing alone. Modern medicine has transformed the worst emergencies with surgery, sterile equipment, antibiotics, blood transfusions, and trained teams. But one ancient element remains in every delivery room. Another person is there, watching, remembering, ready to help. The first pain comes after sunset. Another wave tightens across your body. There is no hospital beyond the firelight, but you are not alone. And for ancient humans, that may have been the most important survival tool of all. If you enjoyed this journey into the distant past, subscribe for more stories about ancient humans and human evolution.